afternoon. My name is Stephanie Mina, and today I will be discussing my systematic review entitled Behavior Change, Calorie Restriction, and Weight Loss. To get started, just a little bit of background about myself. I currently reside in New Jersey as a operations training specialist, currently in my master's program for applied nutrition with the University of New England. And some objectives to go through before we start. By the end of this presentation, you will have an understanding of how behavior change interventions can impact overall weight loss and weight maintenance, understand the influence of physical activity on weight loss, gain some insight into how behavior change interventions can influence biochemical markers and chronic disease risk factors, and gain in some insight into the use of online and mobile-based applications to impact overall weight loss. Some background about overweight and obesity. In the United States, about 93.3 million individuals struggle with overweight and obesity. Overweight is classified as a body mass index or BMI over 25 but less than 30. Obesity is classified as any BMI over 30, however, can be further classified into class 1, class 2, and class 3 obesity. Class 3 obesity is considered extreme or severe, and that is an obesity over 40. There's a high economic burden that comes with overweight and obesity. Many individuals struggling with this will have increased medical expenses up to $1,500 annually, and obesity is estimated to cost approximately $190 billion, or 21% of total medical spending within the United States. Individuals struggling with overweight and obesity also experience higher rates of disability and unemployment, possibly because of discrimination. There's also lasting health consequences that come with overweight and obesity. There's an increased risk for the development of type 2 diabetes, stroke, cardiovascular disease, musculoskeletal diseases like osteoarthritis, and certain types of cancers. In fact, type 2 diabetes is 3 to 7 times more likely to occur with obesity and 20 times more likely to occur if BMI is over 35. Overweight and obesity is also associated with increased blood pressure, low HDL cholesterol, so that's the good kind, high LDL cholesterol, that's the bad kind of cholesterol, and high triglycerides. So common misconceptions about overweight and obesity. Many believe that it is fundamentally caused by an energy imbalance between calories consumed and calories expended. However, there's a number of other factors that must be considered when looking at overweight and obesity. Those can include physiological factors such as hormones, sleep deprivation, appetite signals, genetics, medications that an individual might be taking, as well as environmental factors, especially the built environment, so how much access individuals have to healthy foods and open spaces where they can work out and get some exercise. Looking at the weight loss industry as a whole, it is a highly profitable industry within the United States, making approximately $60 billion annually, mostly generated through the use of weight loss books, apps, weight loss programs, specialty foods, gym memberships. And even with that high level of availability to these resources, obesity has increased by 12%, and severe obesity has increased by 4% in the last 20 years. So to get into the question of what my systematic review reviewed, so the question was, what is the effect of behavior change interventions in aiding weight loss and weight management in adults over the age of 18 compared with calorie-restricted diets? To go over some of my selection strategy for my systematic review, this was guided by the preferred reporting items for systematic review and meta-analysis, so the PRISMA framework. My inclusion criteria for articles included within the review were any studies completed with participants that were 18 or older, overweight or obese adults that had no more than one chronic disease present. Study design preferred was randomized controlled trials, cross-sectional, or quasi-experimental designs. Interventions needed to include at least one behavior change component consisting of nutrition, education, increased physical activity, or improved dietary habits. My year range was between 2009 and 2020, and any articles included in English. Exclusion criteria were any studies completed with participants under the age of 18, with normal weight participants, or participants who had more than one chronic disease present. Study design consisted of, that were excluded, consisted of review articles, poster abstracts, case studies, qualitative or correlational studies. And in terms of authorship, if there were cases where an author was included on more than one primary research article, the most recent article was what was included. Any articles or studies completed prior to 2009 or not in English were excluded as well. To go over my search strategy, I did go through databases Embase, Medline, and PubMed using search terms behavior change, weight loss, weight maintenance, calorie restriction. 23 studies were included in the systematic review, 20 of which were randomized controlled trials. 2 were pre-post study design, 1 was a secondary post hoc analysis, and the last one was a intervention analysis. And just here's my breakdown of how the search was narrowed down. And to get into a little bit of the research, so to start, we're going to go based on themes that I was able to identify going through each of these studies. So the first one is behavioral weight loss interventions. These can address a number of different behaviors, which include dietary intake, improved eating habits, nutrition education, or physical activity. So in 2015, a study was completed with 424 participants consisting of weekly group counseling, a prescribed energy-restricted diet, and moderate to vigorous physical activity. They found that significant improvement was made in weights with a significant reduction in percentage of body fat. Improvements were also seen in physical fitness, reductions in sedentary behavior, and improvements in total plasma lipids. So my next study looked at a 24-week randomized controlled trial examining a weight loss program focusing on improving health education and increasing physical activity. They found that when health education and physical activity were provided together, there was a significant amount of weight loss and improved physical function in comparison to when just health education was provided. And a 12-month randomized controlled study explored the impact of a group-based weight management intervention that targeted diet, physical activity, and usual medical care compared to participants provided with just usual medical care. And that study found that the participants in the group-based weight management intervention did have a significant reduction in weight, and that significant reduction in weight remained over 12 months. To get into some articles on calorie restriction, a 2012 randomized controlled trial looked at how calorie-restricted diets manipulated for protein and carbohydrates affected weight loss. Both groups, regardless of how protein and carbohydrates were manipulated, achieved equal weight loss. However, the researchers did notice that the presence of insulin resistance had a negative impact on weight loss maintenance. And then in 2019, a study looked at the impact of a calorie-restricted diet on weight loss when physical activity was included. Calorie-restricted diets provide weight loss regardless of physical activity. However, increased physical activity provided significant improvements in overall body composition. So something that we would pretty much expect in that type of situation. And then a 2009 12-month randomized controlled trial examined the impact of dietary energy restriction on long-term weight loss. So participants were either had their energy intake reduced by 10% or by 30%. They found that the group in the low energy restriction, so the 10% restricted group, actually produced greater weight loss, which suggests that low levels of energy restriction is actually more capable to be adhered to and provides more successful weight loss over a long-term period of time. And some physical activity interventions. A 2019 12-week randomized trial compared the effect of interval training combined with weight loss and interval training alone on improvements in fitness, body composition, inflammation, and dyslipidemia in patients that had coronary artery disease. It was found that lower calorie diets in combination with aerobic interval training provided significant reductions of weights by about 10.6% in comparison to participants who were only provided with the physical activity, where they lost about 1.6% of weight. Similar changes were seen in physical fitness in both groups. Both did have a physical activity component, so that's not surprising. Non-significant improvements were seen in HDL cholesterol in the group that was provided with a weight loss strategy as well as physical activity. And then in 2010, a randomized controlled trial looked at the impact of exercise on partial weight regain and the presence of disease risk factors. For this study, after a weight loss program, participants were instructed to actually regain parts of that weight. It was found that physical activity helped to maintain improvements achieved through weight loss. So in the previous study, in blood pressure, VO2 max, glucose homeostasis, and cholesterol. So even though they were regaining some of that weight, physical activity helped to prevent any loss and improvements in those areas. However, it did not help to maintain improvements in abdominal fat or triglycerides. Next, we're going to look at how weight loss can improve biochemical markers and disease risk factors. So in 2016, a randomized intervention trial looked at the impact of calorie restriction, exercise, or a combination of both in overweight and men and women. So it was found that calorie restriction, exercise, or even just a combination of both did provide blood pressure improvements, total cholesterol, non-HDL cholesterol, triglycerides, and glucose improvements. So basically, by simply either just restricting calories, just adding exercise into a routine, or adding a combination of both, you are going to see some significant improvements in all of those areas. The study did show a non-significant improvement in the combination of both in comparison to the other two groups. So a combination of both did provide a little bit more improvement in that area. And as I mentioned earlier, insulin resistance can negatively impact weight loss and weight loss management. So the presence of insulin resistance does make it a little bit more difficult to lose weight or to maintain weight loss. And calorie restriction in combination with a low-fat diet provides weight loss along with greater restrictions in triglycerides. So by not only just taking calorie reduction, but also keeping it as a low-fat diet, you're going to see a little bit better improvements in triglyceride levels. And then to go into online and mobile-based applications. So this is interesting because as we go through everyday life, we start to see more and more technology being used, and research has begun to examine the impact that the use of technology might have in aiding in weight loss. So in 2019, a randomized controlled trial was conducted to look at the effectiveness of an online-based intervention to increase physical activity and reduce intake. So groups were provided with either an interactive online platform, or they were provided with a pedometer and access to health education resources. The researchers found that interactive online platforms that provided health education as well as motivation did help to increase physical activity levels and reduce energy intake. In comparison to the other group, no significant improvements were made in that area. And in 2019, another randomized controlled trial looked at the impact of mobile-based applications to promote healthier lifestyles by providing health advice. So in this situation, both groups were actually provided with in-person health advice, while one group was provided with access to a mobile-based application that provided text message reminders for healthy lifestyle habits and health advice. So no significant differences were found between weight, cholesterol, or physical activity between groups. Part of this may be because both groups were provided with health education and health advice in person, so that may have confounded that a little bit. However, both studies do indicate that a mobile-based application might be useful to help in actual weight loss or to help just maintain actual weight loss. And going into weight loss maintenance, in 2012, a randomized control clinical trial looked at weight loss maintenance for up to 4 years following an intensive lifestyle weight loss intervention. So, for a year prior to the start of this study, all participants were involved in an intensive lifestyle weight loss intervention, and then at the start of this, it progressed for all 4 years to figure out how well that weight loss was maintained over that course of time. It was found that greater weight loss at the end of the intensive lifestyle program indicated improved weight loss maintenance at the end of 4 years. So the more weight lost in the intensive lifestyle program meant that they were more likely to maintain that weight loss over the period of 4 years. To go into some conclusions, so we do see a consistent trend that the implementation of a behavior change component in weight loss or a weight loss intervention can provide significantly overall greater weight loss. So that behavior change could be a nutrition education component, increased physical activity, some form of modified dietary intake, whether that be increasing fruit and vegetable consumption or just reducing overall calorie intake. We do see that that does provide a little bit more in terms of how to lose weight and actual successful weight loss. Weight loss or lifestyle interventions or behavior change components might actually allow for increased weight loss maintenance over time. So having that behavior change component or that lifestyle change component into it allows people to maintain significant amounts of weight loss over time because they have some coping mechanisms to go through in the future versus just a calorie restricted diet where they're not necessarily being provided with different tools to use to help them maintain that weight loss. And then the impact of online and mobile based applications is still pretty unclear. However, there is evidence that they might be a tool that can help with increased adherence. So that is something that should definitely be explored in the future. To go through some strengths and limitations. So strengths, there's a wide variety of literature that does provide similar results, that behavioral change components do increase overall weight loss. And within my paper, 20 out of the 23 studies that were used were randomized controlled trials, and they were conducted with a pretty diverse set of populations, ranging from the United States to European countries to other countries as well. Limitations were the studies were reviewed by one researcher. Publication bias may also exist simply because there's not a lot of studies included, so it's hard to evaluate if there is publication bias, and all of the studies that were included simply referenced weight loss or weight loss management or maintenance, and those were the only ones that were included within the review. Taking a look at where we can go from here, so the research provided does give a solid foundation for future research. So we can look into researching the long-term impact of behavior change weight loss programs on actual weight loss maintenance. So as more and more behavior change programs become available, we might see that the weight loss is actually better maintained over time. So additional studies simply looking at how weight loss is maintained would be something that we could look into, as well as research into the impact of technology and how it can be used to aid in weight loss in the future. So that is the conclusion of my presentation. Thank you so much for taking the time to listen, and the next few slides are just my references for the actual presentation. Thanks, have a great day.